Welcome back to the Women's Lounge. It's Wednesday, and you know what time it is. So let's get into it. But first, let's talk about Thanksgiving. Woo! We did not record over the Thanksgiving weekend. Why? Because I was stuck in Chicago in winter, snow, and an abundance of eating. So I hope everybody had a great holiday weekend or week if you had the week off. So it's Wednesday, December 3rd. This episode will be released on Friday, so things may have changed, but hopefully not by much. Why? Well, gather in, gather in, gather in. Um, so today, this is big news. So today, a federal judge in Boston blocked the Trump administration from enforcing their provision in that big ugly bill, which they call the big beautiful bill. We know it's an ugly bill. So the provision in there was designed to strip Planned Parenthood of Medicaid funding in 22 states. So let's just say this. They tried to defund clinics that provide access to birth control, access to cancer screenings, and basic reproductive health care for millions of low-income Americans. And so a U.S. district judge said absolutely not. So the district judge, Indra Talwani, called the law impermissibly ambiguous and warned that letting it go forward would increase the number of patients who cannot access reproductive health care. So she also pointed out that it would raise the healthcare costs for states. Like, we haven't been shouting this through the roof. Didn't need to go to court to know that, but here we are. So she talks about that when people lose access to preventive care, the emergencies pile up. And so it's dire for women. So the ruling is a major win for reproductive rights, but we know it's temporary. So the judge put the decision on hold for 7 days to give the Trump administration time to appeal, and appeal they will, because we know they're petty and we know they want to control women. So we are continuing to watch this. We know they're going to appeal. We know they want to control women's bodies. So the far right and the fight are far from over. We're going to continue with this. So what makes this ruling even more alarming is that since September, when an appeals court briefly allowed the law to take effect, more than 20 Planned Parenthood clinics have already been forced to close. So when we talk about 20 clinics closing, it's not like all of a sudden this temporary ruling will speed up them opening. No, once the clinics are closed, they are closed. And so I think that has been part of their strategy all along. Part of their strategy has been to close the clinics, and let's wait and see. But in the meantime, denying access to healthcare, reproductive healthcare for women, has been their goal, and it's about controlling women's bodies. And so when these clinics close, that means that the communities in rural and low-income areas suddenly lose and have lost access to birth control and basic medical care. So this isn't just about abortion. I don't know about you, but growing up, Planned Parenthood was probably my only access to health care, and definitely my mom's only access to health care. And this is in a big city like Chicago. So let's talk about that, as it's about controlling access and controlling women. So in this instance, when you talk about these rural communities closing these clinics, you are denying access for women, teens, communities of color. You are denying their fundamental right to health care. So that's punishing both the providers, but it's also punishing the community, and it's punishing women. So that's what we're talking about. So the provision ultimately stands. It sets a terrifying precedent as to who is in charge of women's bodies. It's a temporary thing that they're doing, but the realistic part is that it's very glaring that the government wants to control our bodies. And I'm going to repeat it again, not the church, not the state. Women should have the right to choose, not the church, not the state. And the goal is to control us. Let's keep that in mind. It's also talking about who qualifies as a Medicaid provider. And what they're trying to say is that if you have access to abortion, they will not give funds to it. So it's a political move masquerading as policy. So let's be clear on that. So what do? We continue to stay loud. We continue to watch what is happening with abortion rights. As we all know, Argentina passed laws making legal abortion accessible. Mexico passed laws while we lost ours in 2022. So we can't let this fade. We've got to continue talking about healthcare as it pertains to women, as it pertains to reproductive rights, and as it pertains to bodily autonomy. Who gets to control our bodies? It's not the government, it's not the church, it needs to be women. Okay, so that's one. So here's the actions to take this week. We're going to share this story. Most people don't know that Medicaid is under attack. Some may know. I mean, if we remember, the government shutdown not too long ago had to do with healthcare. And don't get me started on, I firmly believe that Democrats should not have folded because we got nothing. And here we are. Also, support your local Planned Parenthood or independent clinic. Volunteer, donate, show up, continue to stay loud around the issue of reproductive rights, around the issue of bodily autonomy. Call your state senators. Yes, even if they are Republican. Call your legislators, your governor. Tell them that you expect them to defend Medicaid access in your state. Tell them that you expect them to stand up for women's rights. And number 4, mobilize your circle of people. Every election touches reproductive rights. So mobilize around your community, whether you believe in abortion or not. Understand that just because you would never have an abortion, it doesn't mean that people should not have access to abortion. Okay, so that's what that means. Choice, freedom of choice. So make sure that women in your life and those feminists are registered and ready to vote. And number 5, share this episode of the Women's Lounge. Subscribe, continue to connect with us, but also send us your questions. We are about to roll out a new format for the podcast. And once we roll it out, we're going to be asking for your questions. We're going to be asking for you to connect with us because that is how we push back. And that is how we continue to advocate. And that is how we will win. And win we will. All right. I'm Emiliana Guereca, your host at the Women's Lounge. So for today, stay loud, stay informed, share, and thank you for listening.